Hello, this is Dr. Steve Fortenberry at Dental Care at Memorial Hermann Southwest. One of the questions I get is what's the best mouth rinse to use? And again, I get a little smart aleck and say it depends. But it really does. Different people have different problems. For just an everyday mouth rinse, you'll never see it used as a comparison as plain old water. It works almost as good as anything else. Water works well. It reduces the germs in the mouth by 100-fold. For over-the-counter mouth rinses, formerly Listerine had research that their formula was the best. However, nowadays the Listerine name is put on all kind of different formulas. So if you want to get an alcohol-containing mouth rinse, because that's the active ingredient in the things like Listerine and Scope, you can get any of the flavors. Those tend to work well. There's over-the-counter also hydrogen peroxide. The hydrogen peroxide in the brown bottle that you pour on your feet is 3%, and you really want 1.5% hydrogen peroxide. I've had a few people tell me they want 100% hydrogen peroxide, however that's a highly explosive powder, so let's stick to the liquid form. Warm salt water we often recommend after surgery. That works pretty well. We have mouth rinses like Biotene that are good for dry mouth. We have prescription mouth rinses like Paradex that are great for people having gum treatment or where we need to kill germs in the mouth. However, they do have side effects, like they can change the way food tastes slightly and stain teeth. For kiddos, we have fluoride-containing mouth rinses. Those are good if people are decay prone. And sometimes it's not just the young people, sometimes older people with dry mouth have the problem. And then there's also mouth rinses for people with dry mouth. So if you can find the one that's appropriate for you, those are good. Another one that we recommend is the Closis. It's kind of a cutesy name. It's spelled C-L-O-S-Y-S. I think you can usually find it at Walgreens and online. And it's probably the best for bad breath. It's been approved, the FDA for that. It was the first approved for that. I think it's probably the most potent active ingredient is chlorine dioxide. If you want information on it, there's a big, long article at the website of the manufacturer, Ropar. Go to ropar.com. But it's an oxidizing agent, so it will also remove stain while it's making the breath better. So that's a good thing. Thanks. I hope that answered your questions. If you have any more particular ones, I'd be happy to answer them.